Garbatelli here. I just want to introduce this new spin-off program and its pilot episode for the Curbsiders. It's called Crosslinks. It's going to be a feature that we'll be having on our YouTube channel, and we'll be talking about topics within the broader realm of public health, population health, social concerns, social determinants of health, wellness, advocacy, and more. Our first episode is on a topic that's incredibly important this year more than most: vaccine counseling and hesitancy. We feature an interview with Dr. J. Cherie Allen. Dr. Allen is a board-certified family medicine physician. She's published with ABC News Health, a contributor on Hippo Education's Primary Care Reviews and Perspectives podcast, and a co-host of the new series Race and Medicine. She's also the creator and host of her own podcast, Millennial Health. She's currently serving as a National Health Service Corps Scholar in central Minnesota, and she completed her residency training at the Mayo Clinic. We hope you enjoyed the episode, and be sure to leave your comments and thoughts in the YouTube channel, and be sure to send us your ideas for episodes. Since this is a new area for us, we're really open to hearing from our listeners about what you guys would like to hear about. Thanks so much, and hope you enjoy. So today I am joined by Dr. J. Cherie Allen, and in this episode we are talking about vaccine hesitancy. So Dr. Allen, can you just tell us a little bit about your story, maybe how you got interested in podcasting? Because as we were just chatting about, you are very prolific in the podcasting world.
Oh, wow. Well, first of all, I have to say thank you so much, Beth, for inviting me to have this conversation with you. This is really exciting. So I am J. Cherie Allen, as you mentioned, a family physician currently practicing in central Minnesota. And I completed my residency training at the Mayo Clinic in 2018 and graduated from Meharry Medical College in Nashville, Tennessee in 2015.
So in the spirit of our parent podcast, the Curbsiders, we like to do our pick of the week. So what's your pick of the week for us?
My pick of the week. So it was funny, before we started recording, you said I do so much, and there's actually something I'm working on that hasn't been made public at all yet.
Ooh.
And that's, I'm working on a startup. And so my husband is from, thank you. My husband's a physician from Ghana. And so a couple colleagues and I are working on a telemedicine startup in Ghana.
Nice.
So my pick of the week is this book that I am slowly but surely making my way through, called The Lean Startup. I feel like I am earning an MBA the hard way. And so that's what I've been up to, just kind of going back and forth with meetings. I mentioned to you, I just got off another Zoom meeting. So yeah, working on a startup. So nice. That's what all my picks are going to be about for the next couple months.
Well, good luck and congrats. And that sounds like a really cool project.
Thank you.
Telehealth is the future, like I think we're getting all more exposure to it now with coronavirus and doing all this telehealth, and it's great. I think that's so awesome.
Mm-hmm. Which was our inspiration for getting this started, just thinking about, delivering health services in a time like now.
Yeah, totally. All right, to dive into our interview topic for today, vaccine hesitancy. It's really been a hot topic the last couple of years. Unfortunately, even before the coronavirus, we've seen, whooping cough has made a resurgence, measles has made a resurgence, and, a lot of the vaccine hesitancy that I think we think about in the medical community is related to pediatric vaccine uptake. But, our interview today is going to be focusing a little bit more on primary care strategies for vaccine uptake in adults. So Dr. Allen, please walk us through sort of what are your thoughts when you're talking about vaccines with your patients? How do you bring it up with folks, and what strategies do you find helpful for this conversation?
So I think it's important that we walk into the conversation with the right mindset, not feeling defeated before we even walk into the room where it's like, oh, here goes another conversation about this, or, you have to come in with the right attitude and give your patients the benefit of the doubt, right? So assume whether it's your patients or the parents of your patients, will accept your vaccines, and then take the conversation from there. But one of the big strategies that I think has been crucial, especially in our clinic, is recognizing that your entire office plays a role in this. This conversation can't start when they see the doctor, right? So when they're setting up the appointment for their annual wellness or a well child visit or a physical, that we ask about some of these things like, are you planning to get your vaccines today? Or, just bringing the conversation up. When your nurse is rooming the patient, saying, oh, in reviewing your record, you are due for, the influenza vaccines out this year, or you're due for your pneumococcal, or whatever it is, right? And just saying that up front and getting the patients on the same page. And then when we come in as the physicians, then we're just, reiterating what's been heard before on their end. So it's not a brand new conversation. They've had some time to sit with this, to hear about it. And so hopefully we're at that question phase, if there are doubts when they do come to your portion of the visit.
I love that approach. It's sort of like you're priming the patient, and giving them kind of exposing them to this conversation that's going to be had. I think that's a great way to approach it.
Mhm. I
Um,
think we look at so much of this as just the doctor, the doctor, the doctor, but I think recognizing that in healthcare, making effective interventions like this, it's a team sport. So getting all of your team players involved from early.
Totally. And how do you see the role of motivational interviewing in this sort of realm?
It is so important in this realm. I think there are several published models on managing vaccine hesitancy specifically. I think there's like the 3 C's: confidence, complacency, convenience, the 3 A's: ask, acknowledge, advice, that sort of thing. But I think what's most important is asking the patient about what is important to them, right? How would a vaccine further their goals or things that they are passionate about? So whether it's, and I use this example with Dr. Rahman in my vaccine episode that you mentioned, right? Perhaps a patient may say, I've never taken the influenza vaccine, or I've never, had that, but I want to spend time with my newborn grandchild, or, I want to spend time with this vulnerable person in my family. And that's the motivating factor for them. So you want to pull on, in the art of motivational interviewing, right? Pulling on reasons that inspire them to want to do something good, as opposed to just harping on, why do you have doubts? Why do you have questions? What have you heard? No. Start first with, what inspires them? What motivates them to do X good thing? In this case, get a vaccine.
Yeah, I like that. That's framing it a little bit more of a positive light. I think a lot of times when I read or think about vaccines, we're thinking about like, oh no, what have you seen on Facebook, and like automatically going to like whatever the scary information that they're concerned about. But framing it from that more positive view, I think, sets it up to be a more positive conversation in a lot of ways.
Yes. Even if, the conversation takes a turn, which we've all been there, right? We've all had
Yeah.
some of those conversations that you put your best foot forward and it still doesn't work out that way. At the very least, you establish some good rapport with that patient, and you leave the door open for future conversations.
Yeah, I've been thinking that a lot of dealing with vaccine hesitancy involves like building that relationship with the patient. And sometimes you'll be surprised, the person who's never had a flu vaccine will they've been coming to you for a couple years and they are like, you know what, I'm going to get the flu vaccine this year. And it's very nice to see that when it does happen.
Especially this year. I've seen a lot of
Yes.
that this year.
Yeah, same with me. Like pleasantly surprised at some first time flu vaccine receivers. And I saw an article that said that positive attitudes with vaccines are correlated or paralleled with concerns about burden of illness. And this is obviously a more negative spin on talking about it with a patient. But how do you convey sort of the risks of getting an actual virus? Because I think people are very aware of these theoretical fears they have about a vaccine. But how do you talk about how bad it can be to get influenza or to get COVID to a patient in a way that's accessible and not super scary?
hmm So I use a lot of our local information. So depending on what's happening locally at that time, because I found that it's sometimes hard for people to accept, especially in certain communities, accept that nationwide data or what the
Mm.
CDC has to say about, the total landscape of the issue. It doesn't correlate per se. But if we can talk about a local outbreak, in Minnesota, measles has been quite an issue here recently, so if you refer to that, because then they can think more of, oh, wow, like I live here, my kids play in this community or, go to school with children who may be suffering from this, so pulling in the local aspects, I think is really helpful with patients that need a little more explaining, especially to give them a little more reassurance about some of the potential side effects or negative, impacts or downside. But then I also try to focus on some of the things that are positive and what vaccines have accomplished for us as a society over time. I actually love when I get I'll say the clapback of, oh, but I don't know anyone with XYZ, or I've never seen anyone with, name the virus or the disease.
Hmm.
And I'm like, yeah, why do you think that is? Right. So
I love that.
I do. I love that we're able to show that it's been effective over time. But I do think it's also equally important to acknowledge the reasons that our patients are fearful, right? Whether it's cultural pressure, the misinformation, and the fear of harm, like you've mentioned before. I don't think we should gloss over those things or write them off as, irrelevant or non-compliant
Hmm.
patients, or that's absolutely not what it is. If you don't have the time in your practice to explain those things in that very moment, perhaps consider at your next visit bringing it up. But I think, each of us, we have to recognize that we're a touch point with the healthcare system for each of our patients. And all these negative experiences or negative encounters, they add up, they're cumulative over time. So whatever we can do in our visit to limit that for our patients, the more we do for their future in medicine, right? And accepting good advice from healthcare professionals, especially those that they've come to know and have come to trust. So it's worth taking that time to understand their fears, ask the questions, provide the best answers that and sometimes too, just saying like, I don't have an answer for that particular question. I think we don't say this in medicine enough. Like, I don't know is a perfectly reasonable answer, but I'll get back to you, or I'll gather more information and share that with you. I think it's important to acknowledge that too.
Yeah, I agree. And I think your point about acknowledging people's fear is so important, especially with, I know there's been like research coming out about, oh, these are the sort of risk factors with being vaccine hesitant. And the ACP was talking about, oh, younger age, Black race, lower educational team, all these like different risk factors. But we have to acknowledge like there's a reason why the Black community is fearful of things coming from the medical community because there's been racism entrenched in our system. So I think like acknowledging that and not saying that it's, a ridiculous fear is part of like building that relationship with the patient and building that therapeutic alliance.
That's huge what you just mentioned. We talk a lot about that on the Race and Medicine series too. Like, that's a big one. But I think also understanding the different cultures that you serve in your clinic and what some of those reasons are, in that particular group. So on the podcast episode, you'd mentioned Dr. Rahman, he is Mexican, and talked about that, saying, sometimes it's actually just the healthcare physician who needs to speak up and actually advocate for the vaccine and say that. And there has been research to show that actually doctors need to say it. We need to voice that this is a vaccine that you need, because our patients really are looking to us to sometimes help them make that crucial decision. So going back to the very first question that you'd asked me to, when we walk into that room, we should assume the best, right? Assume that the patients will vaccinate and that they are at the very least curious or interested in learning more. Start there, not with a negative approach.
Yeah, I think that's so true. So to move on a little bit specifically to the COVID vaccine,
Mhm.
how do you think about counseling patients on that coming down the pike in the next 6 months or so? Because a lot of the, things I like to think about when I'm talking about vaccine safety is, we have years of data. These vaccines are so proven to be safe, like they've been time tested, like that kind of argument. Um, Obviously, the COVID vaccine is being tested and being rigorously examined, but I think patients are concerned about that more. So how do you frame the discussion on a brand new vaccine for this brand new virus that is so scary to folks?
I acknowledge the elephant in the room. Yeah, I do.
Mhm.
And I think you hit the nail on the head when you mentioned, we have time on our side with a lot of these vaccines. Not only the time that it's been tested, but the time that it took to produce that vaccine. I
Mhm.
think that's a major part of, the question and concern that people have now. How was this possible so quickly? And explaining that, there are things that we usually do sequentially that we started doing them simultaneously
Yes.
at this point to get to having the three vaccines at this point as we're recording today. So I think that's important. So just acknowledging the elephant in the room, that yes, this was a much faster process than any of us are accustomed to seeing for vaccines. However, the safety checks and balances were not thrown out the window. Unfortunately, I think we do need to acknowledge that some of this was politicized in or taking out
Mhm.
of the scope of just the healthcare professional. So I think we have to acknowledge some of that. It's very hard for us to make a good case without that. However, maintaining that there are qualified health professionals at the helm of this ship, to put it
Mhm.
bluntly. The FDA has not lost their place in this process. So I think it's important for us to drive that point home to our patients, that what changed here is that instead of doing, you know, everything in a stepwise manner, we kind of combined a few of the steps and started doing a few of them at the same time. Like we wouldn't be working on production this
Yeah.
quickly, right? But before vaccines even been approved, we're talking about production, right?
Mhm.
So again, not that we're skipping any crucial steps. We just had to kind of move ahead and putting some of them side by side.
Yeah. And I think that it's interesting that we're seeing sort of a in process scientific, creation of a vaccine. And comparatively speaking, most of our vaccines besides like HPV were created a really long time ago. So it's just, it does make sense that things are moving faster. We have all of this, computer technology to assist researchers nowadays. And the only comparison I have even in my mind is the Ebola vaccine recently, which obviously not on the same really fast timeline, but
Mhm.
relatively speaking, we, developed a vaccine for Ebola in a shorter period of time than I had expected. So I think that, people are open to the fact that it's going to move faster, but it just seems jarring because of historical precedent.
Mhm. Mhm. Mhm.
Um, but yeah, I think that's great. And in terms of um, what our role can be for fighting fake news, like how do you see that in the role of a doctor? Because a lot of this misinformation is coming from folks Google searching or being on social media.
Yes. And WhatsApp, oh my gosh, the things that come through WhatsApp. So I think it is important for us to be credible voices in this space as physicians. And when we see something that's, untrue or clearly fake news, maybe just inquiring with the individual who posted this, like, oh, can you share the source of that? I found that to be one way of getting people to kind of dig into their own stuff that they're promoting. Like,
Mhm.
where exactly did you get that information? I think that's huge. Even social media, I think, is working on this. Twitter now, if you try to retweet like an article or something without having opened the link, it will stop you
Yeah.
and ask, like, do you want to read that article? So I think things like that are really important. So I do think sharing the knowledge that we have as physicians, whether it's on our social media platforms or with our patients, or creating, pamphlets or patients friendly language that we display in our clinics or our hospitals, I think is very important. But I think on some level too, we have to safeguard against our the deterioration of our mental health in this process, because it can start
Mm-hmm.
to really wear on us as doctors to think, wow, I went to medical school for all these years, I went to residency for all these years, I've been in practice for X number of years, and I'm completely overridden by, what a nameless or faceless, person has to say about this, and it's very
Mm-hmm.
disheartening, to be honest. So I
Yeah.
think there's a limit to, you don't need to go after every single piece of information that's inaccurate or untrue. You don't need to do that. But I think when you feel it's appropriate, or when it's within your bandwidth, right? If you're a podcaster, or you're a writer, or you're just a really active person on Twitter, just sharing the information that you have access to, I think is really important. But without putting that added pressure on ourselves to, save our patients in the hospital and in clinic, and also come and save them on social media too. I
Yeah.
think we have to
Got to have some
we have to draw
boundaries.
the line. Yes,
Yeah.
boundaries. That's what it is.
Yeah, it's so true though that, you can't take on the role of being like the social media sheriff for like all the medical misinformation. And that's why it's really nice to see platforms taking up their responsibilities to sort of make sure that there's not like totally false information getting posted. And I think that's helpful. So it's nice to see that, because you're right. It is sort of like, we already have so much that doctors are doing at home with like EMR and like constant documentation and like building all that extra work in. So like becoming like a social media manager too is like a whole nother
I
aspect.
love social media sheriff.
Right?
Yeah, we're not social media sheriffs.
No,
That's no, we're not.
we can't be. We can't be. We don't, there's not enough hours in the day. All right. This was an awesome interview. I mean, do you have any final thoughts or things you wanted to mention about this topic or anything in general?
I think it's really important, as a final thought I'll leave with everyone listening, to not give up on your patients in this process, and to not give up on your good evidence based strategies, even when they are not effective in having some of these conversations. You do have to recognize, especially when it comes to vaccine hesitancy, there are some major players against us in this arena. And so you're trying to undo, in a 10, 15, 20 minute encounter, what someone may spend hours consuming online. So
Mhm.
be patient with yourself in this process. Approach each new patient with, again, that same positive outlook that we talked about in the beginning. Don't drag something from that last encounter, or someone declining vaccines in that last encounter, into the next one. And then use resources that are at your disposal to help you. You don't need to have all the answers. Like, we're not immunologists, so
Mhm.
just use the information that's out there. The CDC, AAFP, and AAP have created like a really good toolkit, and they have some really good information about this. Like, use some of this stuff, to your disposal. Some of the graphics that you can share
Mhm.
with patients, like, pull on your resources. Don't feel that you have to be the standard bearer for every single person in the world getting vaccinated. Just do your part.
Mhm. Awesome. Well, thank you so much.
Thank
Okay.
you for having me.
Yeah. Have a good rest of your day.
I will. I will.